Hello, I'm Laura Marshall.
And I'm Justine Murphy, and this is Light Matters for March 26, 2014.
On this week's show, optical brain monitoring enables better stroke care, shrink wrap inspires disease detection, antibiotics can be controlled with light, and we highlight SPIE's 2014 award winners.
Advanced technology and simple body positioning could be key in providing acute stroke patients with more effective, individualized treatment in real time. Researchers at the University of Pennsylvania have developed a new optical device that can non-invasively and continuously monitor cerebral blood flow in stroke patients, which allows them to gauge how body positioning could impact blood flow to the brain. Stroke patients are typically made to lie flat for the first 24 hours after being admitted to the hospital to increase blood flow in the brain regions surrounding the damaged tissue. And while this position does help most, the researchers have discovered that for 29% of patients, an elevated rather than flat head position increases this blood flow and is therefore more beneficial. The new device uses a non-invasive probe that measures fluctuations in NIR light that has traveled through the skull and into the brain and then back out to the tissue surface. Diffuse correlation spectroscopy is more sensitive in detecting cerebral blood flow changes with body positioning than the traditional transcranial Doppler method, which uses acoustic waves to measure blood flow velocity of the large arteries that supply the brain. The new optical monitoring technique could someday be performed routinely in all patients with acute brain injury, but the researchers say further studies are needed.
A new technique for better detection of infectious disease biomarkers has scientists looking at ordinary shrink wrap in a whole new way. Developed by a team at the University of California, Irvine, the method uses common shrink wrap coated with a combination of metals to boost the signal of fluorescent markers used in biosensing by 1,000-fold. When researchers shined a light on the wrinkled creation, the electromagnetic field was amplified within the nanoscale gaps between the shrink wrap's folds. Samples of biomarkers, in this case immunoglobulin G, were added to the top of the wrinkled metal layer. The biomarkers were then tagged with fluorescent probes to allow their detection under near light. The researchers also found that shrink wrap wrinkles significantly enhanced the intensity of the signals that the biomarkers produced, which is the result of excitation of localized surface plasmons. Additional antibodies such as immunoglobulin A or M could detect other agents in the future, including cytomegalovirus and the pathogen that causes typhoid fever. The research was published in Optical Materials Express.
Antibiotics could soon be switched on and off as readily as light bulbs, treating localized infections and potentially even cancer in the process. A team from the Karlsruhe Institute of Technology and the University of Kiev incorporated a photo-switchable molecule into an antibiotic so that its biological activity can be controlled with light of particular wavelengths. The researchers developed a diurethylene scaffold-based amino acid analog by modifying a peptide mimetic. The diurethylines are photoswitches, and through reversible photoisomerization, its open form is turned into a closed form. This amino acid analog was incorporated at several sites directly into the cyclic backbone of an annular peptide antibiotic. The researchers could then control the biological activity of the resulting peptide mimetic within strict spatial and temporal limits using UV and visible light. Based on this strategy, switchable antibiotics may offer new options for the treatment of local infections, as they could reduce side effects. Also, new peptide-based agents could be created to treat cancer. The research was published in Angewandte Chemie.
SPIE has announced its 2014 award recipients who are being honored for outstanding achievements in the industry. Among those honored was James Harrington of Rutgers University, who received the SPIE Gold Medal Award for his contributions to the field of specialty fiber optics and for his pioneering work in the development of IR transmissive fiber optics and its applications in laser power delivery, chemical and thermal sensing, and spectroscopy. Congratulations to Harrington and all of the award winners. You can see the full list at photonics.com.
That's it for this edition of Light Matters.
Email us with your questions or comments at lightmatters@photonics.com.
Thanks for watching. We'll see you soon.